Tooth preparation is absolutely critical for CEREC. If you don't prep the tooth properly, you're going to have less than adequate results. The machine is basically a very demanding high-end laboratory technician who wants a great preparation. And when you give the machine what it wants, it gives you a great result. When you have not a good preparation, you're going to get less than adequate results. You get chipping, you get missed mills, and you're going to blame the machine, but when in fact, it is the doctor's fault. In our training, we have a lot of doctors that come in and they say, you know, I'm a good dentist, and for the most part, I'm sure they are. But they've had trouble with the machine for whatever reason, and when we have them prepare teeth on Typodonts, we can see why they're struggling. It's because their preparations are less than adequate. Yeah, the advantages of using ProDrive are many. When I first heard of the ProDrive, I really didn't understand what it was. To me, it was just another handpiece. But it's not until you use it that you find the benefits. Once you use the ProDrive, there's a lot of benefits after you prep. Because I've got a nice smooth margin, my restorations fit better. I have less post-operative sensitivity because there's no chatter, there's not a wobble in the burr. And so when that happens, I'm actually kinder to the tooth structure, which results in less sensitivity down the road. Triangle shank of the ProDrive is really neat. It's a very innovative design, and because it's triangular and not round, it really locks the burr in place. It doesn't slip out, it doesn't wobble, and we have the ability to really lock it in there and have a very precise cut with the handpiece. The cutting power is great, the margins that I can make are very crisp and clear, the handpieces just work very, very well. The benefits of the ProDrive over friction grip are many. You have the ability to lengthen the burrs. Now you can do that on a friction grip, but you know, there's always that fear that that burr is going to slip out. And sometimes with our other handpieces, what we would find is that you're prepping and all of a sudden the burr just slips out of the handpiece. And that's a real danger as it can go down the patient's throat. I have never had that with the ProDrive. I mean, once it's in there, it locks in there. It's very stable, it's very rigid, and it's not going anywhere. In fact, this morning we prepped an 8-unit case with the ProDrive handpiece, and basically ended up using just one burr for my rough preparations and one burr to finish everything out. Previously, with my regular handpieces, I would go through 2 or 3 different burrs, but we were able to get, you know, one burr to last the entire procedure, and that burr's still good, and we'll be able to use it again. The types of preparations that you can do with it, you can do veneers, inlays, onlays, full coverage crowns, basically anything that can be done previously, you can just now do easier, faster, and more precise. I think this is going to be a very powerful thing in dentistry, where it's going to be a product that's here to stay. After using it, you can really see the benefits of it, and I think people are going to really enjoy using these handpieces.